Good afternoon, ladies and gentlemen, and a very warm welcome to the Australia-China Health Summit today. I'm Virginia Birrell, the CEO of ACBC Victoria and the newly appointed National Executive Officer of ACBC, and I will be your MC for today. I'd like to begin by acknowledging the traditional custodians of the country, both where I am here in Melbourne and with the benefit of Zoom, to those attending from other parts of Australia. I pay my respects to their elders past, present, and extend that respect to all Aboriginal and Torres Strait Islander peoples today. On that note, I'd like to officially welcome our online audience to our third biennial Australia-China Health Summit, a collaboration between the Australia-China Business Council Victoria and the Australia-China Health Accelerator. In the midst of the global COVID-19 pandemic, we made the decision to host this summit, as with most of our recent events, completely online. Whilst we may miss the face-to-face connectivity of an in-person event, the online platform means we're able to host an international lineup of expert speakers, sharing the latest insights and welcome guests from around the country and internationally. As we've learned over the last year, adaptability and flexibility remains crucial for ACBC to continue to offer our leading events year-round. Lockdown or not, we persevere. As we've, thank you all for those who've logged in for this afternoon's summit. We appreciate your support and look forward to hosting in-person events in the not too distant future. I warmly welcome all our guests watching from wherever you may be in Australia, China, or even further abroad. This event is made possible through the support of the National Foundation for Australia-China Relations, an Australian government initiative established to strengthen understanding and engagement between Australia and China. ACBC strongly supports the Foundation's aim to bring together government, business, and communities to find and support ways to engage constructively with China across Greater China and to involve the many diverse stakeholders and communities. We thank the Foundation for their support and look forward to hearing from Acting CEO Gareth shortly during our plenary session. I'd like to thank our long-time supporters, the Victorian Government's Global Victoria Division, for their ongoing support of our work, including today's summit and our 12-month China export program aiming to increase Victorian exporter capabilities in China and the broader Asian market. And finally, thanks to our late additional supporter, Invium, a life science company leading the global research and development of photosoft technology for the treatment of a range of cancers. We'll be welcoming company chairman and CEO, Pian Chu, on our third panel today, to provide insights into their product research and development. We have a packed schedule of expert speakers in store, including our special guest, the Honourable Jaala Pulford MP, Minister for Innovation, Medical Research and the Digital Economy. But before we get into our speakers, a little housekeeping for you. This afternoon's session is divided into two phases. The first going from now until 3 p.m, then a short break before we start at 3:10 on a separate Zoom link. Details for these sessions have been emailed to all of you. If you need any assistance, feel free to let us know in the chat or get in touch with Zach, who has passed on his details in this morning's email. The program booklet has been sent out to everyone. In the interest of giving us as much time as possible for our speakers' presentations, my introductions will be brief and we encourage you to read the full bios that we've sent to you. Zach will also post a link to the program in the chat in case you missed it. We encourage our audience today to engage with our speakers and panelists. We have a dedicated time at the end of each panel session for question and answer. If we don't get to your questions, we'll be sure to pass them on to the relevant speaker and get a response to you. So be sure to indicate who you would like your question directed to. To provide an ACBC view and opening remarks, I'm delighted to welcome Tom Parker to the screen. Tom is a Vice President of ACBC Victoria and has recently started as Commercial Business Advisor with the New Zealand Trade and Enterprise. Thank you, Tom.
Tom, you're on mute.
Apologies. Rookie mistake there, but I guess you can't say that after 18 months of Zoom calls. I was on mute. I was just wanting to say thank you, Virginia. And I'd like to reiterate Virginia's thanks to our valuable event partners at the National Foundation for Australia-China Relations. We obviously hope to host you at an in-person event down here in Melbourne. However, until that time, digital will just have to do. Look forward in particular to hearing Acting CEO Gareth Williams shortly when we introduce our plenary speakers. I'd also like to reiterate the thanks for Minister Pulford, and in particular, I think her portfolio of innovation, medical research and digital economy sums up in many ways what today's summit's really about. I'd also like to begin by thanking all of you for being here. COVID-19 has revealed the need for global health cooperation, and over 100 of you are here today send such a strong signal to the Australian-China health community and the broader bilateral business community. As we all know, Australia-China relations are at a critical stage. While diplomatic tensions play out on a government-to-government level, obviously the business-to-business and people-to-people connections remain strong, and today's summit is a reflection of that. As you may know, the Australia-China Business Council's primary objective, as it has been since 1973, is the active promotion of two-way trade and investment and economic cooperation and understanding between the business communities of Australia and China. With a national office plus offices in every state and territory led by Virginia in her new role as National Executive Officer, the ACBC provides regular business-focused activities, advice and counsel for our members base of over 900 businesses. In 2015, the ACBC strongly advocated for the comprehensive China-Australia Free Trade Agreement, which fosters more competitive business in both nations. We continue to support this agreement along with the Regional Comprehensive Economic Partnership Agreement and the countless strong business connections that benefit the economies and the people of both countries. As everyone knows, trade with China remains vitally important to the Australian economy, and our members' connections and networks built over years and decades will hold fast during these challenging times. The ACBC remains confident and committed to the business communities on both sides of the relationship. Recently, China's 14th five-year plan, adopted in March, spanning the years 2021 to 2025, had a very strong emphasis on healthcare and life sciences. 7 of the 20 major indicators of economic and social development in this new five-year plan are directly related to people's well-being, representing the highest proportion of such indicators in the country's history of five-year plans. This ties in well with Australia's pioneering work and substantial government funding in health, medtech and life sciences, of which many companies are represented in today's summit. Complementarity levels are high. As we know, China is the second largest health market in the world, while Australia is ranked number 2 for health systems. China has an immense interest in Australian experience, intellectual resources and inventions. And certainly with CHAFTA, the Free Trade Agreement, there are clearly defined pathways for Australian companies to engage with the opportunities in the healthcare sector. Health and well-being are among the largest of challenges facing China. We know smoking rates, an aging population and environmental impacts are intimately linked to public health and will certainly need to be addressed and are being addressed by the Chinese government. There are opportunities for Australia to collaborate with Chinese organisations as China works towards fulfilling one of the key aspects of its project of modernity, a universal affordable healthcare system for the largest population in history. But Australian business must remain agile. China remains the engine room for global economic growth, driven by its increasingly affluent, urbanised and health-conscious middle class. Today's summit comes at a critical time, and you'll all be here today representing this industry's commitment to the China market. How the relationship adapts and evolves will determine the future prosperity for both nations and the regions. Today's incredible lineup of speakers are among some of the leading voices in the industry and government, and we consider ourselves incredibly lucky for having them in a virtual room like this, zooming in from around Australia and of course from China. One particular voice who's been instrumental in the organisation of today's session and summit, and many will be known to you, is Jason Sun. Jason is the CEO of the Australia-China Health Accelerator and sits as the chair of the ACBC's Victoria Health and Medical Research Working Group. Jason's got over 20 years' experience in multiple healthcare environments, has led a number of national and statewide programs, and is responsible for Victoria's healthcare engagements with China at the Department of Health and Human Services. Jason is an expert in medical technology commercialisation. He co-founded the Upper Asia program, which was funded by the Victorian and Commonwealth Government to assist Australian medtech companies enter into Asian markets. He's the co-founder and director of iTelligence, a Melbourne-based healthcare AI company, which has won major grant from Australian Medical Research Future Fund. Jason is also advising a number of other Australian medtech companies on their commercialisation strategies. An incredible resource to have with us today. I now take the pleasure of passing over to him to provide some opening remarks on how today's summit and session will unfold and to provide an industry snapshot. Thank you all.
Thank you very much, Tom. Good morning and good afternoon, ladies and gentlemen, dear friends, Minister. Welcome to the Australian-China Health Summit 2021. On behalf of the Australian-China Health Accelerator, I'm extremely honoured to collaborate with the Australian-China Business Council Victoria on this important annual event. Now it is in its third iteration. The past event has been incredibly successful, with reconnecting and reforming many friendships and facilitating development of new partnerships through mutual understanding. Due to COVID outbreak last year, the summit was postponed, and then indeed the current event is also forced online. However, this does not mean the health summit is less important or any less productive than the past events. What COVID-19 has taught us is that health or public health is not only important for our enjoyment of life, but it is also critical in all elements of society. This including the economy, our ability to travel, and many other personal freedom. Australia has long been recognized as a leader in health system development and an important global contributor to medical research and innovation. In recent decades, China's innovative capacity in science and technology has also reached new heights. And now it is among global leaders. This can be seen in a number of scientific publications in top journals and international patent applications, working together to make new health interventions and treatment available to everyone in the world seem to me make a lot of sense. China is now the second largest health market in the world and the largest consumer market. It is also projected it will be the largest health market by 2030. Undoubtedly, this provides many opportunities for Australian organisations and individuals. I recognise currently we're going through a period of difficulty in bilateral relationship. However, I'm encouraged by the fact there are so many warm and genuine people-to-people relationships and willingness to work together. I'm recalling many trade missions and meetings between individuals and organizations which I have led or facilitated. And as you can see, winters are always followed by springs. Coming back to today's Health Summit, I would like to give you a sense about how the program will flow from this point onwards. We have 3 panel discussions, which is interspersed with keynote speeches and case studies. Panel 1 sets the scene on current status of the relationship at the policy level. Panel 2 provides a real and contemporary experience for Australians operating in China. And panel 3 provides some ideas on future collaborations in health between Australia and China. All this information is in the event program, and I hope the session will be interesting to you and you are encouraged to put forward your questions. Finally, I would like to thank Virginia and her team, Zach and Alex in particular, for their hard work to make this event possible. Thank you, Virginia.
Thank you so much, Jason. Now, because we're running a live event and because the Minister's actually been called into Parliament, the bells were ringing, so she has unfortunately had to leave for a few moments. I would like to now just jump to Brett Stevens, if I may, to give us a brief presentation. Brett is Victorian Government's Commissioner to China, and he has had an extensive career in Asia, and I'm sure many of you would know Brett because of his vast experience. He is responsible for Victoria's business network in the Greater China region, and he represents Victoria's interests within China, specifically by facilitating trade and investment opportunities and strengthening bilateral relationships through strategic collaboration. We appreciate your support, Brett, and especially for stepping in at very short notice at this point in the program. So without further ado, I'll hand over to you. Thank you. I think you're on mute, Brett.
How about that? Is that working?
Thank you.
Right. Sorry, Virginia, thank you very much. And again, my apologies on behalf of Minister Pulford. She's just sent a message through saying she's been caught up. So let me just grab some notes here. So for those of you who don't know me, as Virginia mentioned, I'm the Commissioner up here in China, and I've been here for the last 12 months, based in Shanghai, and previously doing a similar role, but in Southeast Asia. So let me start by providing a quick overview of our international Victorian Government trade and investment offices. Globally, we have 23 offices with over 100 staff, positioning Victoria with the largest international presence of any state or territory government in Australia. In the Greater China region, covering mainland China, Hong Kong, Macau, Taiwan, and Mongolia, we have 5 offices located in Shanghai, Beijing, Nanjing, Chengdu, and Hong Kong, with a growing team, which is now over 20 people. Now, before I start talking about the trends I'm seeing in the health sector here, I want to first go through some of the key figures in our relationship with China. Now, understanding this data is key to knowing why China remains Victoria's most important trading partner. Now, from a national perspective, China is Australia's largest two-way trading partner in goods and services, accounting for nearly 1/3 of all of our trade with the world. Now, whilst total two-way trade with China declined 3% in 2020 to 245 billion, it's worth noting that Australia's global two-way trade declined 13% during this period, demonstrating the significance of the China-Australia relationship. Now, from an export perspective, Australia's goods and services sales to China totaled 159 billion in 2020, down 6% compared to 2019. Now, hang on, I'm making rookie mistakes here. Now, down 6% compared to 2019, and this decline largely reflects the reduced services export as a result of the COVID-19 pandemic, down 36% in 2020. Now, from our state perspective, China is Victoria's largest two-way merchandising trading partner, and it's valued at almost $32 billion in 2020, with an annual growth rate of 7% over the last 5 years. Now, in 2020, Victoria's goods and services exports to China were valued at 5.5 billion, which is a decrease of 17% from 6.7 billion in 2019. Now, whilst the 17% decrease would normally be a real cause for concern, a significant proportion of this is COVID related, and due to a lack of sea and air freight availability, and not necessarily due to a changing buyer preference in China. I do want to point out, however, that what this data doesn't show is the impact on some of the sectors which have been targeted in the bilateral relationship fallout, as the new tariffs only came into effect after this data period. So as you can see, despite COVID and the current bilateral relationship, China remains a very important partner for Victoria. And I'm going to assume that that's why you're here today, and that you understand this, and that we're going to look, how we can further your engagement with China. Now, this session is about opportunities in the health sector, so I won't talk any further about trade statistics, but I want you to keep these figures in mind throughout the presentation and during the following sessions today. Now, there are two major areas I want to touch on now, and both of them identify potential opportunities for Victorian organisations. The first is healthcare, and the second is biotech. So let me start first with healthcare. You all know the narrative around the ageing population, the rapid urbanisation, and the rise of the middle class. But what is probably not spoken about as much is what impact this is actually having on the nation's health. In 2019, the Chinese Centre for Disease Control and Prevention released a study that showed for the first time that chronic conditions replaced infectious diseases as the leading causes of early deaths in China. With the report noting that lifestyle changes stemming from rising wealth are behind much of the shift, with stroke, heart disease, and lung and liver cancers supplanting lower respiratory diseases and neonatal disorders. Changing diets, particularly with those ages under 40, to foods and beverages with high sugar content are also leading to what many are calling a diabetes crisis. Since 2000, the rate of diabetes increased more rapidly due to changing lifestyles. National diabetes rates increased by more than 50%, from 4,206 prevalent cases per 100,000 in the year 2000 to 6,336 prevalent cases in 2017. And an estimated 6.3% of the population now have diabetes. This equates to about 90 million people. Now in Australia, we've been experiencing this for decades, but the difference is that China's healthcare system just isn't equipped. There is a huge shortage of doctors in China, with estimates around 1/2 to 1/3 per capita of those in most developed countries. For anyone who's ever had to go to a public hospital in China, you will have seen this, with the huge queues of people desperately trying to get in for an appointment. Now, compounding the problem is health awareness, particularly among the middle class. You are much more likely to see someone in Shanghai visit a doctor for minor illnesses that quite often we would just be treating with rest. Now, the lack of GPs also means that those who have a cold, a fever, or other minor illnesses are competing to see the same doctors as those with chronic illnesses, so pressure on the system keeps building. However, with the onset of COVID, where people are less inclined to travel to crowded places like hospitals, a new trend in telemedicine has boomed. As with many of the latest trends in China, large tech companies have also led the charge with telemedicine, including JD Health, Alibaba, Tencent, and Ping An Insurance Group. Now, these companies are pushing to recruit China's 3.86 million doctors into their apps to solidify their foothold in a rapidly growing industry. While 3.86 million doctors sounds like a high number, this represents one general practitioner for approximately every 5,000 citizens. Now, compared with the international standard of 1 for every 1.5 to 2,000 people, according to the World Health Organization. Now, as China continues to build capacity in community health and with GPs, there are opportunities for Victoria in both training and with health tech. Prior to COVID, Victoria was leading the way with GP training with our sister province, Jiangsu, where GPs were invited to travel to Melbourne for training at the University of Melbourne. Additionally, Victorian companies like Ego Pharmaceuticals, who manufacture world-leading eczema creams, are working with community doctors in Nanjing and Suzhou to treat paediatric eczema, so children won't need to go to hospital for mild cases. Now, opportunities also exist for innovative Victorian companies, particularly in preventative health like nutraceuticals, think of Swiss Vitamins, wearable devices for fitness, and in health tech. And I encourage anyone here today to get in touch with Global Victoria colleagues who are online to see how we might be able to assist. Now let's talk about biotech. So as time's limited, I'm not going to talk too much about biotech though, because this is a sector where China is poised to lead the world and there are significant opportunities in Victoria. By the end of the 13th five-year plan in 2020, China has become a major player in global science and technology sector, and we're spending 2 trillion yuan, about 528 billion Australian dollars, or 2.2% of GDP on science and technology, the second highest expenditure after the USA. Now, as a result, the output of significant scientific papers from China, according to Nature Index, is now about 20% of the world's production, and 25% are in bioscience and medicine. And now that the 14th five-year plan, which was released earlier this year, places even greater importance on science and innovation by elevating them to a core national priorities and critical to achieving technological self-reliance. This, with the global outbreak of the pandemic, has also put the spotlight on the life sciences industry, with the public paying more attention to topics such as early warning and prevention of infectious diseases and vaccine research and development. To give you an idea of how big the industry is here, now excuse the slightly old stats, but by the end of 2018, China counted 4,441 pharmaceutical manufacturers. However, despite this large number, over 70% of these companies had annual sales of less than 100 million RMB, so equivalent to about $21 million. Chinese companies lead the world market as suppliers of active pharmaceutical ingredients, vaccines and antibiotics. In 2018, the size of the pharmaceutical market was about 2.1 trillion, equivalent to 434 billion Australian dollars. Now, 12% came from biologics, with a share of 39% for vaccines, 16% for recombinant insulins, 15% of blood products, mostly human serum albumin, and only 11% from therapeutic antibodies. Most antibiotics are considered chemical drugs and don't fall into this category. However, generally speaking, highly innovative drugs still originate from international companies, and Chinese manufacturers excel in generics and TCM, basically traditional Chinese medicine. However, innovation is strongly supported by the government through tax breaks, government purchase regulations, and infrastructures such as science parks, so we can expect to see more innovation coming from China in the near future. Now, drug discovery is one of these areas. Now, if we look back to 2017, 40 of the 41 pharmaceutical products launched in China originated from multinationals. Now, this was partly due to the fact that local biotech companies were focusing on in-licensed drugs already approved in the West that are not available domestically. But a pivot to innovative drugs is underway, with several companies bringing homegrown innovative drugs through their pipelines, and this is where opportunities exist in clinical trials to be conducted in Victoria. Now, as you would have heard from Minister Pulford earlier this morning, phase 1 trials are also available, are able to begin within a week of registration, and importantly for Chinese companies, these trials are recognised not just in Australia, Europe and the USA, but also in China. Now, through Invest Victoria, Victoria's investment attraction agency, we are actively seeking Chinese pharmaceutical companies like Fosun Pharma, Sinopharm, and others to partner with our world-leading clinical trials network and centres, including Cancer Trials Australia, Nucleus Network, and Neuroscience Trials Australia, to name just a few. Now, I'm going to leave it at that for today because I'm just as keen as all of you to hear from the sector experts in our panel discussions next. So to finish off, please get in touch with me or the team at Global Victoria if you're interested in any opportunities in the China market, either from a trade or investment perspective. Thank you, and I really hope that you enjoy the rest of today's event. Thank you very much.
Thanks, Brett. It's always good to hear from you. It's terrific to hear all those statistics, and you're always a great enthusiastic proponent of the Australia-China relationship. So thank you very much for that presentation. Now, diverting slightly from our running sheet, if I could please ask Gareth Williams to come to the screen. Gareth is the acting CEO for the National Foundation for Australia-China Relations, and they are the major partner of this event, and without their support, this event would not be possible. We are delighted to welcome you, Gareth. Gareth has an international career which has seen him previously posted overseas to the Australian Consulate in Hong Kong, Australia's mission to the UN in New York, and the Australian Embassy in Bangkok. And we warmly welcome you here today to say a few words. Thank you.
Well, thank you very much, Virginia, and I wish to acknowledge that I'm speaking from to you from the lands of the Gadigal people of the Eora Nation, acknowledge the traditional custodians of the various lands on which we are all located, and pay respects to elders past and present. This is the third in the ACBC's Industry Summit series, supported by the National Foundation for Australia-China Relations, with others held already on agribusiness and international education, and an upcoming summit that will focus on innovation. As Virginia mentioned, the National Foundation is a national platform that brings together a range of stakeholders to support practical engagement across Greater China for mutual benefit. The Foundation has indeed identified health as a priority sector for engagement, for collaboration on research and innovation, and for commercial opportunities. As Tom and Jason mentioned, and Brett, the growth in China's health sector, which is, as Tom mentioned, the largest in the world, is driven by a growing middle class, changing demographics, and demand for high quality and efficient healthcare. Of note, China's aging population is anticipated to reach around 450 to 500 million people over the age of 65 by 2050. So I think that shows the scale of the challenge for China and the opportunities. And those opportunities for Australian industry include health services, aged care, and senior living sector, facilities design, biotechnology, medical equipment, and digital health services. For our part, the Foundation is supporting a range of activities in health engagement with China, including our support to the Doherty Institute and in their research into COVID-19 immune response, which they're doing in partnership with Fudan, Hong Kong, and Tsinghua universities. We're partnering with the George Institute for Global Health in its work to improve the sustainability of health sectors, both in China and Australia. And also with Flinders University, with their collaboration in dementia, caregiver education and research. And I expect we will be announcing further projects shortly. I won't take up too much time because there's a huge range of excellent experts. So I wanted to thank you again, Virginia, and the ACBC for hosting this important summit. The Foundation is pleased to partner with you on this summit series. And it is great to see an excellent selection of speakers here today and over 100 participants with diverse experience and expertise in the health sector. And I think that's a testament to not only the work of the ACBC, but also the significance of the opportunities in health engagement with China. I trust that this will lead to productive discussions on the opportunities and the challenges that you have in all your engagements with China in the health sector. So thank you very much, Virginia, and look forward to hearing from Minister Pulford. Hopefully she's able to return from the division. Thank you very much.
Now, being nimble again, we are still waiting in hope that the Minister may have been able to return, but I think she's been caught in Parliament. So if I could ask Brett Stevens, if you wouldn't mind taking on the role of Minister, I'll just give a little background to the Honourable Jaala Pulford MP. She is the State Minister for Innovation, Medical Research and the Digital Economy, and she was very enthusiastic about this event and being part of it. She was appointed to the Ministry of Employment, Minister of Innovation, Medical Research and the Digital Economy and Small Business in June 2020. And she was also appointed the Minister for Resources in August 2021. And she's the Andrews government's first female Minister for Agriculture, as well as Minister for Regional Development and Deputy Leader in the Legislative Council. So she's a multi-talented lady, and unfortunately she's been called into Parliament, as I said, but she has prepared speaking notes. And if I could hand over to Anthony, to Brett, if you wouldn't mind reading her speech for us. Thank you.
No problems, Virginia. So everyone on the call, Minister passes on her sincere apologies, and she's made a commitment to come back, Virginia, for another event. Now I'm going to present today the Minister's speech. So I'd like to start by acknowledging the traditional owners of the land in which we meet and pay my respects to elders past and present. I'd also like to acknowledge the organisers and hosts of the summit, Virginia Birrell, Jason's son, CEO of the Australia-China Health Accelerator, David Olsen, National President of the Australia-China Business Council, and Dr. Amanda Caples, who is Victoria's lead scientist. Now, I'm delighted to be here today to help open the Australia-China Health Summit. I'd like to start by congratulating the Australia-China Business Council for putting on the conference despite the obvious and current challenges. And it's so important to continue to maintain an open international dialogue at all times. Now, Victoria is committed to its relationship with China, and through our International Trade and Investment Agency, Global Victoria, we are represented on the global stage with Chinese offices in Shanghai, Nanjing, Chengdu, Beijing, and Hong Kong. We have a long and proud history of working closely with China, and we are home to some of Asia Pacific region's top universities, research organisations and companies, offering strategic and mutually compatible strengths across medical technology, advanced manufacturing, and food and fibre, to name but a few. Now, against the backdrop of a global health crisis, it's never been clearer how much shared capability and mutual expertise are needed to find a solution to this shared problem. We think there is a great complementarities and opportunities for all of us across the health sector, and I look forward to discussing some of these with you later. Now, as Australia's leader in health and medical research, Victoria's health and biotech sectors offer strong possibilities for cooperation with China. Our vibrant biotechnology commercial sector manufacturing expertise make Melbourne a highly sought after destination for global companies and already a strong partner to Chinese pharmaceutical companies for clinical trials of new medicines in Victoria. We are committed to building upon this foundation, creating opportunities for new partnerships that align and leverage our mutual strengths in areas like genetics and genomics, neuroscience, regenerative and personalised medicine, innovative therapeutics and diagnostics, clinical trials, and digital health. We believe Victoria's health and biotech sectors offer strong possibilities for cooperation with China, and that there is a strategic opportunity to strengthen relationships in China across these sectors. Now, something else we both share a commitment to is fostering innovation. Victoria's commitment to growing our global innovation networks has helped make our economy the strongest in Australia and led to partnerships like those enabled through the Monash Technology Transformation Institute. This is the largest commercialisation partnership between an Australian university and China, and will further establish Monash as a global player for the translation and commercialisation of medicines, medical devices, and engineering inventions. Victoria also remains committed to its long-standing sister state relationship with the Jiangsu province through its Program for Technology and Innovation R&D program. We also remain committed to our Sichuan sister state relationship. With the potential to change millions of lives, we want to continue to encourage more world-leading innovators to establish operations in Victoria. Now, in conclusion, I look forward to building on this legacy of cooperation and mutual respect as we recover from this crisis, further aligning our complementary strengths. And we want to encourage more collaborations. And thank you very much for the opportunity to participate today.